With a cancer diagnosis, life can change in an instant, from decisions about treatment options to concerns about the outcome. But the impact of that diagnosis can last long past the treatment and care. We are joined now by two people who have been through that, each in very different situations. Martina Mellang and Paul von Goertz. Thank you both for being here today. We certainly do appreciate it. Let's learn a little bit about each of you. And first, Martina, I understand that you were first diagnosed with your cancer as a child.
Yep, that's correct. Yep, I had leukemia when I was 3, and then I had the reoccurrence. So I was 20 years cancer-free, so I had reoccurrence with basal cell skin cancer, and then in the past year, I just was diagnosed with parotid cancer and then thyroid cancer.
Now, as a child of 3, do you remember much of that experience at all?
I remember bits and pieces of it, as Dr. Weirma had stated, but they give you drugs actually to not remember it. But it was a big chunk of my life. It was the whole year that I was in the hospital. So yeah, there's lots of it that I do remember and the bad times that I don't.
And once you had become cancer-free as a child, were you told, or were your family watching for possible reoccurrence?
Not at all, not at all. So I remember as a child I was very scared for the reoccurrence, and I was just very scared. I couldn't even ask anybody about it. It wasn't until a couple years ago, maybe 3-4 years ago, that we were introduced to Dr. Weirma, who was doing some studies on the reoccurrence as an adult. And this was before my diagnosis with my second, third, and fourth cancers. So with the follow-up and with the research, that kind of stuff, and now getting to know more about it, then you learn a lot about the reoccurrence and the health factors as an adult.
All right. Now, Paul, when were you diagnosed with prostate cancer?
About 4 years ago this month.
And what were some of the treatments involved?
Well, the level of cancer was such that I needed to have it removed, a prostatectomy, and so I did that, and then that was there's several options, and I chose this one with advice of my doctor. And then I was quote cancer-free at this point with negative margins, and which means the tissue surrounding the tumor in the prostate were negative. But then 18 months later, it came back.
And where are you with your treatment now?
Well, we watched that PSA level rise, and I think most people know what the PSA is. It's prostate-specific antigen, and it's a chemical given off by prostate cancer cells, and that can be tracked and measured. And that kept increasing to a point where my doctor said, you've reached the line in the sand, we need to do something. So last October, I started 7 weeks of radiation therapy at Essentia Health. And now it's this kind of a waiting game to see if indeed it was successful.
Well, we wish you well, and we hope it is successful.
Well, initial indications are it is. It has, the radiation therapy is working, and it'll probably take about a year before I know for sure. But radiation therapy does offer a cure. So we're very optimistic.
Okay. Martina, how do you maintain such a positive attitude, especially when these reoccurrences happen?
Well, I fought this battle before, so it's just this inner drive to fight another very familiar battle. So I like to keep humor in my life, surround myself with very positive people, and so I have a great support system in that aspect of it, and then accepting the things that I can't change. I know that cancer didn't choose me and I can't control it, but there's lots of things that I can do, so I stick to, a healthy lifestyle and that kind of thing, which we'll get to later. And the reality is at 25, it's not a favorable role to be in. So there are times when I'm not positive, and I think that's just the nature of life.
And Paul, was it hard to make treatment decisions, and did you have a lot of support through this process?
Well, yes. I think the first decision you need to make is where do you want to be treated, and then a particular physician. There's some physicians do more of these procedures. It's a urologic procedure. So you need to decide what physician and where you wish to be treated. And then your physician will outline to you probably 4 different treatment options. So those are decisions the individual needs to make. And what I found very helpful is talking to anybody that I knew who was a prostate cancer patient or survivor. And so I made about 10 different phone calls, talked to 10 different people. Some people I didn't know that well. Some were husbands of women my wife plays tennis with, and everybody was very helpful, and that helped me with my decisions. Because I was talking to prostate cancer patients and survivors and felt their knowledge was very beneficial to me.
So that education process was very important.
Yes, it was. And at the time, unfortunately, I was not aware of the Essentia Health Cancer Resource Center. I wished I had been aware at that time. That would have been helpful.
All right. Well, once their treatment is wrapped up, patients have different approaches when it comes to making lifestyle changes that could improve their overall health. Kim Kaiser talked to an oncologist with common sense advice for taking control of your diet and exercise.